Let's hear now from the hospital side. Dr Ian Higginson is Vice President of the Royal College of Emergency Medicine. Good morning.
Good morning to you.
So we hear there that GPs have serious concerns about this. What about you?
Well, thanks for having us on. So I haven't read the plans in detail. I've read your summary of the plans, but it's one of those things that instantly I just want to sigh. It seems to be based on a number of incorrect assumptions. One of those assumptions would be that SAS doctors who are really quite busy holding the NHS together at the moment, they're a varied, talented and incredibly valued group of highly skilled professionals. One of the assumptions is that they're sitting around not doing terribly much and can be sort of redeployed at will. And that's not the case. They're working incredibly hard in our hospitals, contributing to the health service in that way and fully engaged. And the second assumption, which often applies to my own speciality as well as general practice, is that you can just take anyone with a medical degree and plonk them between specialities. Now, you wouldn't suggest that you could take somebody who has no surgical experience and put them in an operating theatre and do an operation. And it's just the same for general practice as it is for emergency medicine. GPs are not just any old doctors. They're highly skilled, highly trained specialists in primary care and longitudinal care. And they do an amazing job, just as emergency care doctors do. And you can't just sort of manufacture a spare GP at the drop of a hat. It just doesn't happen like that. And it's quite disrespectful to both SAS doctors and general practitioners to suggest that you can. As Professor Hawthorne has pointed out, these sorts of things need to be properly thought through, carefully implemented, and we really need to think about the training and safety implications sitting behind them, so that you end up with a result that's actually desirable, rather than just a cobbled together, apparently quick and easy solution to a crisis which has been building for years.
Well, let's unpack some of what you say there. I mean, the Times is reporting this morning there are 63,000 of these SAS doctors working in Britain, and the numbers are projected to top 100,000 by the end of the decade. It makes them the largest single group in the NHS. The General Medical Council is saying there is capacity for this to happen. Those doctors can be moved out of a hospital setting and put into GPs. You're saying that that's simply not the case?
Yeah, what I'm saying is that the assumption there is that those doctors will wish to move into general practice, and SAS doctors who wish to move into general practice will seek to access general practice training schemes. And in fact, many of the SAS doctors I encounter in my department move on to work in general practice, and it's great to see them working out there after they've finished all their training. The second assumption is that you can take a hospital doctor, put them in a general practice surgery, and everything will be all right. They'll be fine. They can just crack on and be a GP. They can't. I'm actually dual trained. I trained as a GP before I became an emergency physician, so I'm properly trained and properly qualified in general practice. I could not go into a general practice, just sit down and start working. I would need retraining. I'd need a lot of supervision and effort be put into me before I could start practicing effective and safely as a general practitioner again. And the same would be the true of any professional that you move between specialities. It's not quite as simple as just putting them in a different place and saying crack on.
There's quite a few listeners getting in touch this morning saying, this is the problem. It's this, we can't do it. It's a burden. We don't want to change direction. It's a kind of negative attitude coming from medics, when actually you look at the situation in the NHS, we need to sort out general practice. Isn't it better that there are some additional doctors going in to help GPs? Because for a start, wouldn't it kind of relieve the pressure on hospitals? I mean, for example, at my GP surgery, we have a nurse who does take some of the load off GPs. So she might give out antibiotics, for example, or something like that. Couldn't these specialist doctors come in and do some of the work that GPs are doing, the less general stuff, to take the pressure off? I mean, isn't it better to have more doctors than not?
Yes, again, there are a number of things underpinning what you've just said. But so take the first word, negativity. I think actually it's frustration rather than negativity. So the Royal College of General Practitioners, the Royal College of Emergency Medicine, we've been saying for years and years, look, get your act together. There's a workforce problem of epic proportions coming down the road. We can see it like a train. We need to have a proper plan in place. And that plan has simply not emerged. And although we're being promised a workforce plan, it remains to be seen whether it's got any actual hard numbers behind it, any funding behind it, any tangible ideas behind it. So then when you come up with short-term ideas to try and plug the gaps that haven't been filled, it is intensely frustrating because we could do it properly or we could do it badly. And this strikes us as it strikes me as one of those sorts of things where, okay, we've realised we've made a mistake. We haven't done our workforce planning properly. What sort of short-term ideas can we come up with to plug the gap? Oh, here's a good idea. Let's do that without thinking it through properly. So I don't think that's negativity. I think that's frustration. And I think what all of us want to see in the NHS is decent workforce planning underpinned by the right data, the right expertise, so that we come out of the end of it with a properly trained medical workforce. No one is saying that there are enough GPs. The Royal College of GPs are certainly not saying that. We're not saying that. The patients know that. But you can't just plonk doctors from one environment into another and expect them to work at the highly skilled level that GPs are practicing. And you've got to think, if they move from one environment to the other, who's going to do what they were doing in their other environment? They're not sitting twiddling their thumbs in hospitals. Yeah. Hospitals rely on medical workforce just like general practice does. So I don't think it's negativity. I think it's frustration at the sort of short-termism that permeates the NHS at the moment.
Fair enough. Listen, thank you for your time this morning.
Thank you very much.
That's Dr Ian Higginson. He's Vice President of the Royal College of Emergency Medicine, talking about frustration there and saying, it does kind of assume that there's a whole load of hospital doctors just kind of twiddling their thumbs, ready to be plonked, as he put it, into general practice.
The problem is we don't want to talk down GPs because there are magnificent GPs, but we've all had experiences where we've gone to a GP with something relatively straightforward when presumably anyone could have prescribed it. We've gone to GPs where they've been Googling the thing and then offering some prescription which anyone with a medical degree could do. So the question is, as your point was very well made to him, is something better than nothing? And the point, though, we've heard from two experts now is they're actually not. And here's a third expert, Ben, who's a GP himself. I'm a GP and I welcome any additional help in practice, but SAS doctors will need supervision by GPs. On a Thursday, I supervise a pharmacist and physician associate clinic while doing a full one of my own. That means that at any point during my clinic, I can be interrupted for help from my colleagues. Adding a third person to do this is just adding to our workload, not helping. So that's what the GPs and the emergency doctors think. You can have your own opinion as well, of course. 87222, start your message with the word Times, or you can tweet us at Times Radio. It is now 17